For a better understanding, we spoke to Sanho Tree. Now, he's the director of the Drug Policy Project Institute for Policy Studies. We asked him what efforts are taken on a multinational level on the Mekong against drug trafficking.
Well, the various countries are coordinating and trying to interdict the flow of drugs and organized crime, to stop organized crime, and that's great. No one's against going after violent criminals and such, but I think it's different from confusing that with an effective drug strategy. Whether that's actually going to lower rates of drug abuse and addiction and improve health outcomes is another question, because there are all these unintended consequences, as we've seen over the many decades we've been waging this war on drugs all over the world, that sometimes we end up making the problem worse. So, for instance, the drug traffickers very often develop substitutes, much the same way that alcohol prohibition in the United States turned a nation of beer drinkers and wine drinkers into a nation of liquor drinkers. Because if you were smuggling during Prohibition, the last thing you want to smuggle was a keg of beer. You wanted something compact and potent. And in many ways, our war on cocaine in the 80s helped popularize the poor person's cocaine, crack. It was much easier to make and distribute, less bulky. And our war on crack in some ways helped popularize the poor person's crack, methamphetamines. Right? Each time you end up with a more dangerous, more compact, easier to produce, more difficult to stop, more problematic drug. If you're starting to stop heroin, originally the problem was opium, right, coming down in the Golden Triangle region. And traffickers adapted with a more potent alternative, which was heroin. We've had a war on heroin for many years now, especially in the United States. And traffickers developed substitutes for heroin. So fentanyl, they're adulterating heroin with fentanyl now, which is about 100 times more powerful than morphine, about 50 times more powerful than heroin. And that is causing a lot of overdoses here in the United States and elsewhere, because the dealers are stretching their profits because we're interdicting the heroin. And now there's an even more deadly substitute, carfentanil, which is many, many, many more times dangerous than fentanyl itself. This is what they used to tranquilize elephants with, and it's showing up in our heroin here and killing lots of people. So be careful of the unintended consequences.